the patients themselves will not see any difference. They won't know a difference, other than their food might not, you know, but hopefully a patient doesn't come so often that they know the difference between last year's food versus this year's food. So, but overall, no. From a patient's perspective, at this point, so long as this report is fulfilled in the sense of the funding's fulfilled, that's outlined in this report, and the changes we made now, from a patient's perspective, nothing's going to change, okay, from their lens. If the funding doesn't happen, then we're in a different discussion. Because we have older facilities, so we spend more time in certain areas trying to keep these areas as best as we can without having a, you know, we're limited in what we can do. So there'll be some negative impacts there.
Dirtier places in the hospital?
Not dirtier, it's just, you know, like maybe we won't be able to polish a certain area as often as we do now, like do some, so things like that. One of the things we pride ourselves on is we have the lowest ER admit time to inpatient bed in the province. Meaning the minute a patient is admitted from the ED, to get from the ED to an inpatient bed, that was our thing we did 2 years ago to eliminate hallway medicine, is we focused in on that. Is the way you eliminate hallway medicine is once a patient's admitted, we pride ourselves within 3 hours they're in an inpatient bed. What does that require? Housekeeping staff. So we're going to struggle a bit on that. We're going to continue to work on that, but in large part that has a lot to do with housekeepers cleaning that bed from the patient that was discharged to make it available quicker for the patient from the ED to be pulled up.
So the patients are going to notice a difference?
Well, we hope not. That's until we'll see when we see. Okay,
like try to keep the same ratio.
It's an unfortunate famous saying: do more with less.